What do we know about the long-term impact coronavirus has on people's mental health? Lockdown and isolation have led to unprecedented levels of anxiety, stress, and depression. So, what is the psychological cost of the pandemic? This is Inside Story. Hello and welcome to the program. I'm Mohammed Jamjoom. Depression affected more than 264 million people worldwide, and suicide was the second leading death among young people. That was before the pandemic, before distance and isolation became our new experience of life, before grieving loved ones without being able to say goodbye, and before the sudden loss of jobs. Such difficult experiences have led to elevated levels of stress and anxiety, experts say. They warn of a potential rise in suicides and drug abuse and a possible psychological cost in the coming years after the pandemic is over. Human Rights Watch has urged governments to expand mental health care services, and the UN says facilities already lacking resources and people fleeing violence are of particular concern. The UN Secretary General says depression and anxiety are some of the greatest causes of misery in the world. He's launched a mental health policy brief. This is what Antonio Guterres has appealed for in his video message.
Mental health services are an essential part of all government responses to COVID-19. They must be expanded and fully funded. Policies must support and care for those affected by mental health conditions and protect their human rights and dignity. Lockdowns and quarantines must not discriminate against those with poor mental health. As we recover from the pandemic, we must shift more mental health services to the community and make sure mental health is included in universal health coverage.
That brief points to surveys that show an estimated threefold increase in symptoms of depression among Ethiopians since the start of the outbreak. An increase in distress among 45% of people surveyed in the U.S. That went up to 60% in Iran. Those most at risk are medical staff, overwhelmed by patients and worried about the risk of infection. People facing stigma for contracting the virus are at a heightened risk of post-traumatic stress disorder. So are those who lost family members or became unemployed. Experts warn more people are using substances and alcohol sales have increased. People in conflict zones urgently need support. For example, South Sudan has one mental health professional for every 4 million people. All right, let's bring in our guests from London. Donna Dawson, a psychologist specializing in personality and behavior. And from Bangalore is Kriti Sharma, a senior researcher in the Disability Rights Division at Human Rights Watch. And from Beirut is Maysoon Hamza, a social psychology consultant. Thank you all for joining us. Kriti, let me start with you. Human Rights Watch says one widespread consequence of the COVID-19 pandemic that we cannot afford to neglect is its toll on mental health. So let me ask you, how much of a toll has the pandemic taken on mental health so far?
We did a survey really asking caregivers and students what their experience has been under COVID and how they have been impacted. And the overwhelming response was that families were struggling, were overwhelmed with anxiety, panic attacks, exhaustion, and that the mental health impact of COVID has been devastating. It is something that we are seeing around the world.
Donna, the United Nations has warned that the coronavirus pandemic could cause a global mental health crisis. What do you think? Will that happen, or has the crisis already begun?
Yes, I think it's already begun. I think helplines in this country, and I'm sure all through Europe and in America, they've doubled and tripled phone calls about anxiety, panic, fear. These things are happening in families, to individuals, to people who have had disease in the family, and to those who haven't, because those who haven't are afraid they're going to get it. And I think it's impacted some communities more. I think the news that Black and ethnic minority groups are more highly affected by COVID has affected that group much more in terms of anxiety, because there is a feeling of helplessness. What can we do? And the children are picking up on that as well. In fact, the young Muslim helpline over here, I think, has had a 300% increase in calls from worried children who obviously have parents that have fallen ill or relatives, and they're worried now for themselves, which is unlike other groups which haven't had as much contact with the illness.
Maysoon, who are the people currently most vulnerable to mental health distress?
Yes, according to what we are facing in Lebanon and all over the world, we can see that the main two categories in society that are being affected on the basis of mental health are the children and adolescents and the elderly. Why? Because we know that due to old people and people who are facing certain physical problems and health problems, they are afraid of being affected or of being, of catching this virus, which might cause severe illness or might lead to death. So they are afraid as a category, especially according to certain societies and according to what media has shown. The availability in hospitals and the medical care, and especially we are facing a pandemic and a disease that is still strange, and we know nothing about the consequences and how to face this pandemic. And also according to adolescents. Why we speak about adolescents? Because at this time, or due to the sudden shock or the trauma that is taking place, and according to the social distancing, sometimes they cannot understand what's going on according to their to the fear they are facing and according to what's going on. And especially they are being locked down with their families, and they are being at the same place with the people or the category of people they usually fight with them or try to escape from them. And concerning the children, because they don't know how to cope with certain trauma that will take place, like death, like they are afraid of losing their parents, they don't know how to take care of themselves, and being alone or locked in the houses as well, and being away from their schools and their daily routine.
Donna, you heard Maysoon just speak about the toll that this is taking on children, especially children who aren't at school right now. You know, so many countries have closed schools. This has disrupted routines for parents as well as children. How much of a toll is this taking on those families?
Well, this is an interesting point, because for those children who don't have any connection to the illness, it's difficult for them to understand unless they're teenagers. And a lot of the younger children are suffering mostly from boredom and frustration at not seeing their friends. But what's happening, I've noticed, is that mothers and dads who are trying to be substitute teachers are finding it very difficult to step into that role now. And children are getting very frustrated, having to use computers for homework, having to deal with all the work that some teachers are piling up on them. A lot of this is kind of work that's ad hoc to keep the kids' minds busy. The kids are getting very anxious about completing tasks, about where they're going to fall in the ratings when they get back to school. Have they dropped back a form? This general anxiety is from kids from about 8 till 14, I've noticed. And so basically we're compounding the issue by trying to keep them busy and mentally stimulated. A lot of children are getting terribly frustrated with the way they're having to do work at the moment, and that's adding anxiety. So in some senses, it's not helping them the way they're having to be educated at school. For some kids, for instance, who are addicted to computers because of gaming, and I have a grandson of 14 that falls into that category, he will go onto the computer, he'll pretend to start his homework and then go straight to the game, and you would have to stand over him all day. So basically, it's increasing the dependency and the obsession and not helping with the homework at all. So for him, he's had to be taken off the computer, and we've had to ask the school to send paperwork they haven't been able to do. So the whole system is flawed, and kids are getting upset with that now as opposed to just with the illness. So for those who don't have any contact with the illness, the frustrations are now at home with having to be regimented with work, with having to feel a failure if they haven't done it, to try and complete it, and to try to do some work they've never seen before. And for my daughter, the parents that are involved, so frustrating, very difficult, and that's increasing the parental anxiety as well.
Kriti, from your perspective, are governments around the world heeding calls like the ones Human Rights Watch has made to expand mental health care for their citizens?
It's a very important question. Our survey was responded to by over 200 people from across 54 countries. And what we find is that the COVID pandemic has really exposed how broken the mental health system is. From low and middle income countries to wealthier nations, there is a real dearth of mental health services. As of now, the system is really centered around crisis care. If you have a mental health condition, which 1 in 4 people have, and you need support, in most countries, you will find it either in counseling or in places like a psychiatric hospital. And what happens under COVID is you can't even do in-person counseling. It's very difficult for caregivers like mothers to even call their therapist on the phone while you have your husband in the next room or your kids doing their homework at the dining table. And so we really find that this has exposed the cracks and the weaknesses. Governments are yet to respond in an adequate manner. We see an example like the New Zealand government, which has really committed to addressing this issue, not just in terms of budget, but also providing services, emergency mental health services under COVID. However, the situation is very different in lower income countries, where the crisis is compounded by social isolation, broken welfare state, and of course a humanitarian crisis when so many have lost jobs and are affected by poverty under COVID.
Maysoon, there's so much anxiety and uncertainty in the world right now. I'm wondering, can anxiety that people experience develop into anxiety disorders or into depression?
Let us be a little bit clear concerning this question and concerning anxiety and depression and the panic attack. There is something very important we must know. Whenever people, they are facing certain trauma, many of the psychological or mental health symptoms appear suddenly they appear, and because our strategy or the way we face the trauma, it's different among people. That's why we cannot say that each trauma or COVID-19 might lead to depression suddenly with people. It might lead to depression with people who have the symptoms. They carried the symptoms according to different lifestyle they used to live and according to the previous history they lived with their families and during their lifetime. COVID-19 might lead out, or it's a way out to show these anxieties and to show the depression. Or does it suddenly make us or lead to depression? According to my school, the analytical school, I can say it's related to my previous history and a previous lifetime I've lived, and according to the way I respond to the trauma and how I deal with problems. But what we are sure about, and we can say that we are pretty sure about, is that it might lead to certain obstacles concerning the doubts concerning future and the uncertainty. Because what happens due to COVID-19 and due to trauma taking place, it leads out to all the fears to come out and to start thinking about how we are going to live the life we love to live. Are we going to go back to our routine? Because you know that people adapt according to certain social routine concerning going to their work, their social relationships, hanging out with friends, according to children, their physical activities and the school routine. So how we are going to live after this pandemic is finished? Are we going to go back, or there is another lifestyle, a new lifestyle we are going to face? This uncertainty and the fears we are facing, I think it needs to be, we must think about it in the future. And here comes the healthcare and the responding to the mental health and the aid we can give.
Maysoon, I'm sorry to interrupt. I want to pick up on a point you were making about the kind of trauma that people are experiencing, and I want to ask Donna specifically about stigma when it comes to people who've recovered from COVID-19. What kind of stigma could those who've recovered from COVID-19 face from their communities, from family members, from colleagues, perhaps?
That's a strange word to use for survival from such an illness. I think in this country, people are looked on as almost heroic for having survived it. I don't see that stigma. And I think if people were to stigmatize them, they would maybe be laboring under the false belief that they could still catch the disease. I don't see that word in British society particularly. And I think if we're talking for children and anxiety, I was listening quite intently to the last conversation. Children have a huge capacity to recover if they get back to any kind of sense of normality. Now, we're going to have to be entering a new form of reality, a kind of adjusted form in terms of the measures we're going to have to put in place for some length of time. But I think children will take their example on how to feel from their parents. If their parents have managed to stay calm and well adjusted and take things in their stride, the children will feel more reassured. And I think we need to keep talking to children in language they understand. But at the same time, I think schooling them a little bit from social media. There's an awful lot of stuff on social media that isn't correct, that will fan their fears. And I think parents need to be the stabilizing force here. I think if you were depressed before, COVID certainly is going to make those symptoms worse. But I don't see it as creating long-term or permanent depression in people, particularly children who weren't affected before, because we're all going to have to adjust to a new reality. It isn't just some of us. So we're all in this together. So you're no longer outside the system feeling isolated, different, with fears that are unfounded and only pertain to you. That isn't happening. When you're depressed, you seem to feel overwhelmed by things that you can't control. Well, we're all in that same position. So I think, yes, there will be anxiety, but I don't think it's going to lead to anything that's permanently damaging, because we're all working together to help each other. And the world is going to get, as we go forward through the pandemic, the world is going to get slightly better in a lot of ways. So we will get to a new normality with some specifications on how to keep ourselves safe.
Kriti, I want to ask you specifically about one of the most vulnerable populations in the world, and that would be refugees, it would be migrants, it would be the displaced. Has the survey that Human Rights Watch has done encompassed voices from those communities? And what are you finding, if you have been hearing from them? How concerned are they, and what kind of a toll has this taken on their mental health?
That's a great question. And in fact, I would like to say that the pledge is still open, the survey is still open. And we are trying to gather voices from around the world. So, those of you listening, we would love for you to go to the Human Rights Watch website and take the survey. As of now, amongst the responses we haven't had a lot of responses from refugee communities. They do not always have access to technology and to especially under COVID situations. But what is really important, I think, to highlight is the mental health, trauma that they deal with on a daily basis in refugee camps, in camps for internally displaced people, when they face significant challenges. Just take Greece, for example, in Europe. Refugees in Greece are facing a mental health crisis for the last few years. When they come in from Syria, when they come in from conflict-affected areas, and then they face uncertainty about their future, they don't receive support. Even the basics like food, water, education is a struggle in these camps, and that's their daily routine. I think they are definitely amongst the most at risk under the pandemic. But I think let's not forget also the other parts of the population. And I wanted to, just come back to the point of stigma that you raised. I think this crisis gives, all of us an insight into what it feels like to be locked up at home, what it feels like to face this anxiety and uncertainty. And that is something that people with mental health conditions are dealing with around the world on a daily basis. I have investigated mental health issues for the last 9 years, and everybody from, looking at cases of people who are chained to trees or locked up in goat sheds in Indonesia, to Aboriginal people dying in custody in Australia. This is a reality for people with mental health conditions around the world. And I think that's really, what we would love for governments to take away from this crisis is how can we support these people who are most at risk, who even today remain invisible and who are left out of the COVID response.
Maysoon, is the fact that mental health is being discussed more openly right now a sign of progress from your perspective on this front?
Yes, of course, and this is what the increase in the calls that the hotline is receiving all over the countries, not only in specific countries. Yes, people now are open to speak about mental health and are open to speak about their problems because out of a sudden they are facing something that they cannot, how to interpret their feelings or to speak about it. But this is still different among societies and according to the cultural environment we are living with. Let me state something very important concerning the cultural diversity and according to the cultural differences among societies. For example, we all know that in Eastern societies, especially in the Arab world, we used to know that and we used to see that whenever we face a problem or a trouble, we always go to families in order to take the support. And when I speak about family, we are speaking about the big family, the extended family. Now, due to this pandemic, we are seeing that social distancing has put us in a situation that we need to be at a distance from all the people that we love because to maintain our security and to keep people safe. And this is a big change and a huge change in the daily life routine and sometimes in the cultural values and traditions. That's why the only way to speak out is that to speak about mental health and to seek the support and to seek the aid through the hotline and through special organizations and even on the things that are taking place on social media, because social media and media is taking a big part or playing a major role in opening up to people and to make people opening up and speaking up about their feelings and how they are feeling now and how to cope with the new lifestyle and how to seek help all over the world and especially in our countries. Yes, we might be open in the coming or in the future, in the very near future, concerning mental health and seeking help, psychological help. And this is what now the NGOs are speaking about and the social policies and the governments are taking this into consideration in order to support and help people to live better and to think better about their future and their fears and to get rid about all these traumas and the fear.
Donna, it looked to me like you were nodding to some of what Maysoon was saying about communities and families and social isolation. We only have a couple of minutes left, but go ahead if you wanted to respond to what Maysoon was saying.
I absolutely agree. Communication about mental health issues is the first port of call. It's where we need to begin. For too long, that's been a stigma, the idea that you might have anxiety or depression or panic attacks or obsessive thoughts and couldn't bring that anywhere. Unfortunately, what's been pointed out is true in Britain. A lot of mental health services are disjointed. They've been underfunded for years. They rely on a lot of voluntary organizations and charities. Families can at least reach each other over technology via phone or computer. And now we're allowed to see people, our loved ones, about 6 feet apart, which has eased it somewhat. But we need to talk. And if we start with family and we start with extended family, and then if we need to take it to the professionals. But I think right now, all the mental health sectors in most countries are struggling to deal with the sudden rise in people needing to contact them for advice. And yes, there are some wonderful resources online that people need to tap into. But the first place we need to do is to discuss the fact that we have a problem and that we need help. That's where it has to begin. And that's true of all of us now. And we're all suffering the same fate. And in that way, we're united. And let's hope we can just move forward with helping each other more.
All right, we've run out of time, so we're going to have to leave it there. Thanks so much to all our guests, Donna Dawson, Kriti Sharma, and Maysoon Hamza. And thank you, too, for watching. You can see the program again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed Jamjoom, and the whole team here, bye for now.